The pandemic caused worldwide damage, economically, socially, and of course to people's health. But some communities have actually come out of it stronger. Welcome to the COVID-19 special. In a poor part of the Venezuelan capital Caracas, some neighbors had the bright idea of opening a cinema at a great height. Cine Platabanda was so successful that it's still running after the lockdowns. And we head to Uganda to accompany a blind man as he goes about his everyday routines. During the pandemic, restrictions on public life hit disabled people particularly hard. But first, to Germany. In the town of Marburg, a medical team is researching the effects of long COVID, including ailments apparently caused by vaccinations. Demand at the clinic is high.
Marburg an der Lahn, a small town in the western German state of Hessen. In this idyll is one of Germany's few treatment centers for people suffering suspected adverse reactions to COVID-19 inoculation. Here at the University Clinic, 32-year-old Vera and 26-year-old Alexander are looking for help. They've suffered major health problems since their COVID inoculations a year ago, experiencing a variety of symptoms that are making life difficult. It's Alexander's first time in Marburg. He had to wait 8 months for an appointment. The outpatient clinic for post-vac is overrun.
It's my third time here, and look at how the readings have changed. It could be down to the medication.
Okay.
What are your main problems?
Exhaustion is the main one.
Neurological problems are still the main thing for me. The pain in my hand and my nerves, and my immunity. And my hand is still misaligned since last winter.
Do they have an idea where it comes from, the nerves?
They did a biopsy on my nerve tissue and found nerve damage. It stayed rigid like that.
And you were healthy before?
I definitely didn't have that beforehand. No nerve pain either.
After the inoculation, I clearly had something. 5 days later, I had vision problems and dizziness and headaches. I went to the optician and was told I had blockages behind both pupils, the precursor to thrombosis. And that was then traced back to the inoculation. But in the months after, it's now 12 months ago, I got more and more varying symptoms, like dizziness and heart palpitations when standing up. Also nerve pain and pins and needles. Nobody believed me then. I was dismissed as mentally ill.
I was always told it's nothing measurable, but they did do a biopsy of my nerve tissue. And I hope that with all cases it's taken seriously and not put down to being just in the mind, that when someone comes in with numbness, the doctors do a biopsy.
The cause of post-vac syndrome is not yet known. Patients develop varying symptoms. A wide range of factors could play a role, such as undetected illness or infection at the time of inoculation. The many factors make treatment difficult, according to Bernd Schiefer, a cardiologist and head of the post-vaccination outpatient clinic.
You have to look closely, and that's what takes so much time. And it also makes it so hard for us to do our jobs here and then convey the findings. I can't simply tell Dr. So-and-so who's just phoned me, give me your instructions and we'll do it just like that. Everyone is more than welcome to observe our work here, to come and look at our lab method.
During the forensic search for causes and appropriate therapy, the employees at the Center for Unrecognized and Seldom Illnesses are in demand. Here, blood samples of those afflicted are broken down into individual parts and analyzed.
We believe that inflammatory processes can be triggered in some patients through a COVID infection or an inoculation. Why that is, we don't yet know. That's what we're in the process of researching. It's improving here. You see here that it's dropping in many patients. I wouldn't just blame it all on the inoculation. There are surely also genetic factors that play an individual role. Everyone has thousands or hundreds of thousands of genetic variations in their genomes, and those are perhaps triggered more in one person than in another. It's not so easy to analyse that ad hoc. These are scientific questions that can take a while to answer. You can't cure or understand an illness just like that in 1 or 2 weeks. It can take years. Some people work their whole life to identify the way an illness works.
2 years after inoculations began, there is still a lack of clinical studies on the cause and treatment of side effects.
We also need clinical algorithms so that patients no longer remain in diagnostic limbo. And we need treatment centers where they know what to do.
Vera's visit to Marburg has at least brought her cardiological problems under control. But her medical odyssey continues, both neurologically and immunologically. After filming, she was diagnosed with damage to her immune system, which requires further treatment. Vera and Alexander, who must first see if his new medication helps him, decide to remain in contact. They intend to compare notes and support each other.
Over 15% of the world's population live with a disability, a majority of them in poor countries where healthcare is lacking. These people were hit particularly hard by the lockdowns, with even the simplest aspects of daily life posing big problems. DW reporter Julius Mugambwa met up with a blind man in Uganda's capital, Kampala.
Gad Tumasime is passionate about music and also about law. He wanted to study to become a lawyer, but then COVID-19 hit. He was due for an admissions test when the university moved the applications online, which left the blind man in the dark.
Find out if you are in the right place for. Establish the working rules.
Because everything was done online, and for us, we were green about online. I missed pre-entries for Makerere as I had applied. I couldn't come because by the time we were supposed to come, they closed that transport and schools were closed as well, so I couldn't be successful in law.
Gad Tumasime is now studying to become a teacher, but he hasn't yet fully adapted to e-learning.
I had to look for someone to help me upload my examinations, and sometimes issues could happen and my exams could not upload. It really lowered my performance. If I'm to compare my performance in year 1 and year 2 is better. Because year 2 we had no such issues. We're doing exams physically.
At his university, signs with measures to prevent the spread of COVID-19 could be seen across the campus. Tumasime felt left out. It became an uncomfortable experience.
I wasn't able to identify those areas where water is to wash my hands, unless I had maybe someone say, come and wash your hands. That's when I could realize. But in most cases, after entering campus, I got my guide like after 3 weeks, because you choose a guide for yourself. And before, in those 3 weeks before getting a guide, even navigation, the mobility wasn't all that. I could get lost to different places.
In the community, Tumusime faces related challenges like accessing public transportation. He says that this worsened during the pandemic when the government shut it down. There were no exceptions made, even for people with disabilities who rely on support from others.
We were restricted. Even when you're with your guide, you're moving on a border. They want you to be on separate borders, but at the end of it all, you get yourself lost.
Those bodas, Uganda's motorbike taxis, were his lifeline during the pandemic, which left him more isolated than usual.
For the community members, many people have not understood us. They don't normally socialize with us. So it's very hard in the community.
About 3% of Uganda's 47 million population are said to be visually impaired. They are part of a wider global population of 1 billion people living with some form of disability. Research shows that during crises, the disabled often suffer most.
Already, when you have a disability, you have a burden of dealing with all the things you may not be able to do. Some of them are mobility, some of them are, with education. And so with additional restrictions of not being able to move, not being able to access, at least the little services you would have been able to access, was an added burden. Statistics show that amongst the poor people, people with disabilities are the poorest. So if a normal, regular Ugandan lives on $1 a day, then a person with a disability is even worse.
After the pandemic exacerbated the plight of many, Gad Tumusime hopes people will learn from it. He hopes for a more inclusive society where people like him are no longer overlooked by their communities.
Electrical engineer Yakuiti Atwich moved to Kenya's capital to find work. Of his 3 children, his eldest son accompanied him. But then Yakuiti caught COVID-19. Today we're in Nairobi as part of our My COVID series.
I was hearing that lots of people were dying from COVID, even rich people. So when I got it, I was prepared because I thought, who am I to survive if even presidents were dying? People who have everything they need to protect themselves.
My name is Yakuiti Atwich. I'm an electrical engineer in Kenya. I had COVID-19.
I remember it was in 2021, and it was a Wednesday. I was working, and everything was fine until the evening. That's when I started to feel as if I had the flu. I had difficulty breathing. So I went to a private clinic to get tested. When I told them my symptoms, they first decided to do a COVID test. And when the results came in, I was positive. I was shocked. My eldest son was living with me because he was studying in Nairobi. So he also had to get tested. Fortunately, his was negative. I considered checking into a quarantine hotel, but my son would be left alone at home. It was so challenging. In the end, I stayed at home and we wore our masks every day. But I wasn't able to sleep at night. I used to stay awake because I was afraid that if I fell asleep, I would die. After 2 weeks, I went back for another test, and luckily I was negative. Since having COVID, I've been dealing with health problems that I didn't have before. For example, now I have problems with digestion. That wasn't the case before COVID. Work has not been good. I have 2 boys in college and my daughter is still in high school. It's been very challenging to earn enough money, and that's hit me very hard. After recovering, I was vaccinated for the first time. I also got a second dose, as well as the last one, the booster shot. The government measures have helped reduce cases. If you compare when people were not wearing masks to now when people are, you see the infection rate has gone down drastically.
Do you have a question about COVID? Our science editor Derek Williams tackles them based on the latest research and analysis. Write to him at covidproducer@dw.com. This week he answers a question from Susan. What does research currently say about repeated COVID-19 infections?
Remember back in the early days of the pandemic when having and getting over a bout with COVID-19 at least was thought to have a big upside, which was that survivors, for the most part at least, felt protected afterwards, kind of like the way I remember feeling after getting my second dose of vaccine and then my third dose of vaccine. But now that we're all swimming in what's being called variant soup, that idea no longer really holds water. I personally know many people, including a couple in my own family, who have had the disease twice now, and a few who've tested positive for it 3 times. That shouldn't actually come as a huge surprise. I mean, after all, the 4 coronaviruses that generally cause cold-like symptoms are able to infect us multiple times throughout our lives. So reinfections are certainly possible, but how often will they happen in the future? Will COVID-19 become seasonal like flu? That seems likely, though we don't know how long exactly that process will take. Health authorities do mostly agree that otherwise healthy people who recover from COVID-19 are generally at low risk of getting it again for at least a few months. But each person is going to have a different immunological history with the disease. So it's impossible to really predict your individual risk. And if immune evasion turns out to happen in different ways with different subvariants, experts say you can't really rule out possibly getting infected by them, even in fairly short order. Omicron and its subvariants, though, have really kind of thrown a monkey wrench into what we thought we knew because they're super infectious, and several look like they're better at evading immunity than earlier versions of the virus. And Omicron also continues to mutate at a pretty fast pace. That ability, the experts say, could easily cause numbers to spike pretty hard and fast in the coming winter in the Northern Hemisphere. When it comes to disease severity upon reinfection, however, the news is more positive. Most studies I've read show that when reinfection does happen, the course of the disease in general seems to be milder.
Residents of a slum in the Venezuelan capital Caracas found a new way to stay in contact despite pandemic restrictions. They came up with the idea of starting a rooftop cinema. The project turned out to be so popular that it's still going strong.
red brick shanty homes rise steeply on the hills of Petare, in the east of Caracas. Home to Jimmy Perez, Petare is one of the largest slums in the world. The flat rooftops here are called platabandas. These open spaces gained new significance during the COVID-19 pandemic.
It's a place on the roof of a house made with construction materials. In the populated areas, the Platabanda is a social space where people celebrate birthdays, 15 years birthdays. Carnival activities take place here. The Platabanda holds people's memories. It guards a family's most treasured feelings.
The rooftops became the base for the project Cine Platabanda. Launched in the first months of the pandemic, it used outdoor cinema to relieve residents confined to their homes. The events have continued beyond the quarantines and lockdowns and expanded to include live music. More than 200 screenings have now been held, with several scheduled each month. The project was a reaction to the increased level of violence and suicide experienced during the pandemic. The project's co-organizer and Jimmy's twin brother Jaime explains the program.
There are children films and documentary films. One important film which deals with the fight against depression. This is for a population that is living through trauma and going through the process of mourning and sadness. Also the scars left by Venezuelan social situation. All of that was projected into our Platabanda cinema screen, which was welcomed by the community and generated awareness. The result was the level of violence was reduced.
As the film ends, residents flash their lights to applaud, and not only for the entertainment. They are grateful for the connections the rooftop events have created.
Sometimes there may be events which I can't see from my house. We speak with our neighbors who are watching, and we move to their house and sit together because they have a big balcony with a good view. We already knew each other, but now we share more. This rooftop project allows us to share more, have more contact. And now we're more integrated.
The pandemic intensified the social problems which have plagued Petare. Gangs used the lockdown to step up criminal activity. Petare, known as Venezuela's most dangerous place, became even more insecure. Through Cine Platabanda, the community reclaimed public space. The organizers say their initiative showed Petare's residents how to take action where public services fail.
I aspire to see violence reduced in Petare. It's the only way. If there aren't people like us who take care of important topics, necessary topics, then we will be in a Petare without hope and without future. We aspire to have a more humane community with a better education, with a better opportunities, where people feel useful. And we are showing that without government, without being part of structures, we have demonstrated great achievement, significant and important achievement for the people, for the community, for children, for caretakers, and for parents.
The Cine Platabanda team drive their equipment to one of the poorest parts of the giant settlement, where their excited audience awaits. This screening is for the children who hardly get to visit a real cinema. Donors have signed up to provide food for kids who frequently go hungry.
Many parents are without work. They can't take care of their families. There are children who go to bed without eating. When I started coming here, they told me, "Glenda, I've gone 2 days without eating. 2 days without food." It's something he has experienced.
They give us a lot, and now we're bigger and stronger.
This cinema project is shining a light on how a community can come together even in the darkest moments.
That's it for today. See you next week on the COVID-19 special, when we'll show you other ways in which people across the world supported each other during the pandemic. In a Buenos Aires soup kitchen, for example. Thanks for watching, and stay healthy.